Welcome back. A hysterectomy is the second most common surgery for women, and having the option of a minimally invasive hysterectomy has really become a game changer. Who, what, how, and why all matters, right? Those are the questions this morning for Baptist Health Dr. Julie Goodwin. Thank you so much for being here, Dr. Julie.
Good morning.
So we hear a lot about hysterectomies. For the people who don't know what it is, what actually happens during a hysterectomy?
So a hysterectomy is just simply the removal of the uterus. A total hysterectomy is when we remove the uterus and the cervix. In lay terms, we often incorrectly hear partial or total, and they're referencing if we remove the ovaries or not. But anytime we say a total hysterectomy, all we mean is we remove the uterus and the cervix. We talk about the ovaries in a totally different way.
So how are hysterectomies typically performed?
So they were traditionally done in an open technique. So a bigger incision, which had more pain, more blood loss, required an inpatient stay, and took longer to get back to life. But thankfully now they're pretty much always done in a minimally invasive route, which would include either vaginal or laparoscopic or robotic. And those offer so much more advantages, so less blood loss, less pain. Most of them can go home the same day, so that also means faster return to work and life.
I remember my mom, she had one several years ago, and, you know, she couldn't really do anything for herself. She needed help walking, you know, we had to cook for her and things like that. But now you're saying things are a lot smoother for women.
Yeah, so I tell people to get up. I want them walking every single day. I want them, like, walk, walk, walk. That's my instructions on every one of them.
So how do you decide which method is best?
So that really comes down to the who. So that is more on the surgeon most of the time. Pretty much any benign hysterectomy can be done in a minimally invasive route, just not necessarily by any gynecologist. If an abdominal hysterectomy is being offered at this stage, they really should ask for a second opinion. I would look for someone who is either fellowship trained in minimally invasive surgery or someone who has a focused practice designation in it. Those are surgeons that tend to be higher volume, and they've done additional training and proven their higher volume. That higher volume really does make a big difference.
All right, Dr. Goodwin, thank you so much for your time this morning. If you would like to contact Dr. Goodwin, you can do so by contacting Baptist Health by going to baptist-health.com or calling the Baptist Health Line at 188-BAPTIST.